Hello, in this video I'm going to be talking about, does stress cause breast cancer? Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content. I'd also love to invite you to go to yerba.com to get your personalized breast cancer report. Does stress cause breast cancer? It is so common to think that it does. And the research is actually pretty thin on whether stress causes breast cancer, and I'll explain why. The first thing is that stress is best viewed as being over the entire life course, from in utero and actually even generations before we're born. So multi-generational trauma or stress, then when we're in the uterus, and all the way through our early life into adulthood. And it is very difficult to do studies where we longitudinally follow people for generations. We lose people from studies like that. They stop participating. The people who experience the most trauma and stress are the least likely to participate in studies. The other reason it's difficult is because much of the research relies on self-report of stress. And people who have an event, breast cancer, are much more motivated and inclined to go through their life retrospectively and think backwards about all the things that were stressful in their life compared to unaffected controls. So somebody who hasn't had breast cancer may spend 10 or 15 minutes thinking about adverse events and stress, and much less likely to report those same stressful things that people who have the disease of interest, in this case breast cancer, they're much less likely to do it than somebody with breast cancer. So that's one of the reasons it's difficult to find robust research. What we do know, however, is that there's a relationship between chronic stress and outcomes, whether it's autoimmune disease or psychological disease. Many conditions related to inflammation are linked to stress, in particular things like area-related stress, violence, including intimate partner and domestic violence. We know that people who live in areas with chronic noise and light pollution, where there isn't time and space for quiet and peace, that these chronic exposures, in particular in certain neighborhoods or cities, that those exposures are associated with chronic diseases. Heart disease, for example, as I mentioned, autoimmune disease, other things related to inflammation, migraine disorders are associated with trauma and chronic life exposures to trauma and stress. I'm using these interchangeably, trauma and stress, and I hope that's okay. If you have a question, feel free to drop it in the comment below about why I'm using them interchangeably in some cases. Diagnosed with breast cancer? Meet Yerba, your guide to personalized treatment options. Each option is specifically tailored to the unique characteristics of your tumor. Sign up today at yerba.com to take control of your breast cancer journey. But we also know that in the case of breast cancer, that stressors can lead to different tumor behavior or biology. So people who have chronic stress, there's one study showing that people who have been living with chronic domestic violence, intimate partner violence, are more likely to have triple negative breast cancers. And those cancers grow more quickly and are often diagnosed at later stage. We know that people with chronic inflammation are more likely to have triple negative breast cancer as well. So why might this be the case? What's the mechanism for the relationship between stress, especially chronic stress, and cancer? Well, there are a few things. The first is our immune system. Our immune systems are brilliant at cleaning up cancer cells. All the time in our body, abnormal cells are forming. It's just what cells do the longer we live. And when we are chronically stressed, the immune system is suppressed, and so it can't clean up those developing cancer cells. The other thing is that chronic stress is associated with changes in hormones. It's associated with changes in cortisol. So when we're under chronic stress, cortisol levels initially will go up, and actually over time, our adrenals that make cortisol can become fatigued. So it's not always a solution to measure cortisol. People who are chronically stressed can actually have lower cortisol levels. And also cortisol levels fluctuate throughout the day. This is why it's been so difficult to measure chronic stress, because under chronic stress, again, cortisol levels may increase and then they may the adrenals kind of poop out and can't make cortisol, and also those fluctuations throughout the day. It's also the case that we know that cortisol is a precursor to other hormones. And so if cortisol is raised, you can see other hormones increased, and as cortisol decreased, those other hormones may go down. So specifically related to breast cancer, we can actually see higher levels of testosterone and then estrogen, maybe leading to further growth of hormone receptor positive breast cancers. And if cells lose their hormone receptors, they can then become hormone receptor negative. So it's complicated, as you can see, but our hormone system is finely tuned until it's not. Finally, people who live in chronically stressful environments are the same people who don't have access to safe places to play, healthy diets, room for recreation and rest and sleep. So if the environment is noisy or there's light pollution, or if they're constantly patching their lives together, you can see how that stress, whether it's from violence or light or noise pollution, can lead to a whole host of other risk factors and other exposures. I hope this has been helpful. It's a serious topic. I'd love to hear your comments or questions below. We try to get back to you within 1 to 2 weeks. If you're a scientist and you've studied this, please share your thoughts with us. If you're working in this area, we'd love to hear more. As always, thank you for watching, and don't forget to subscribe to our channel.